the question then became, were they going to just not report these figures in their annual reports any longer, or were they going to stop tracking them altogether?
Welcome back to Closer Look with Michael Friscolanti, our editor-in-chief here at Village Media. I'm Scott Sexsmith, Derek Turner at the controls this evening. Glad you're with us. A great show last night. What a conversation with Cameron, and a very exciting time for him with the Olympics kicking off.
I'm a loser, but I always talk about the kind of shows that I just love.
We didn't say that.
That I love that we do. I love when we have a conversation with someone who's in the headlines. It's all over the news, but we actually have a really intimate conversation with the person and explore all kinds of different issues. And what I loved about Cameron is I didn't know this till we started talking. He won the OHL championship with Era. Yeah. So this guy is like, it's almost as high as you can get in Canadian hockey to play in the CHL. And he's on a championship team. The Erie Otters wins. They would have gone to the Memorial Cup. They didn't win, obviously, but they get there. So this kid grew up playing in the highest levels of hockey.
And also went to the Leafs training camp.
Yeah.
Right?
Exactly.
So let's not forget that.
That's right. And then to hear him talk about why we love hockey and how hockey still has some work to do to get better, right? I found that just really refreshing and fascinating because we're all going to get lost in Team Canada now. We love the Olympics. For sure. We especially love hockey.
Yes.
It means everything. We all know how we felt during the Four Nations Cup. I was on we stayed up so late to watch that overtime game because it just felt like the world was resting on who was going to win that Canada-USA game.
Yeah, there was a wonderful piece last night on Wednesday Night Hockey where John Cooper was interviewed by Elliot Friedman. And there's a guy I want to sit and have a beer with.
Oh, he's the best. Remember, you've seen him on the bench yelling at Marner and McDavid to get a goal. Then they go out and get a goal. And it just felt like it meant absolutely nothing, but it meant everything, right? And people feel that way about these Olympics. And let's hope they don't get the norovirus or whatever's going around.
That's awful.
What team was that? The Finnish team?
Finnish women's team? Was it 13? 13 players.
So you prep for the Olympics. 4 years you're thinking about you get there and you get a virus.
Yeah.
It's a terrible, terrible luck.
I think Derek's right. Screw it. We're playing.
I wonder if they
don't care if you're down 13.
I wonder if they have hallway. That's right. I hope they don't have hallway healthcare in Milan.
Man, your segues are just gold. Pure gold, Jerry.
Well, gold medal. That's right. That's right.
It just writes itself.
It does.
Yeah, hallway healthcare today.
Yeah, back in the news. Snea Dougal, our wonderful deputy editor at the Trillium, breaks so many stories in a year. Yeah. So she has a great piece today about how, hallway healthcare has been a problem for a long, long time. Snee's going to fill us in on not just how long. But if I remember right, Doug Ford, when he first campaigned to be the premier in 2018, promised to end hallway healthcare.
Yes, he did.
Nothing's changed. There's still lots of people in, what do they call them, unconventional spaces in hospitals. And there's a report put out annually that measures and puts out the metrics of how many people in Ontario are actually in unconventional spaces at any given time. Yeah. Well, as Snea reported today, they're quietly wiping out that metric. They're not going to publicize it anymore, which has got some emergency room physicians and lots of experts pretty upset because the only way to fix a problem is to admit you have it and look at it and,
of course.
And try to figure out, and share it with the public how bad it is.
Yeah.
So we're going to talk about that with Snea, dig deep into her piece and what people are saying about
it. Way back in 2018, now Premier Doug Ford campaigned on a promise to end hallway health care. The glaring problem of hospital patients being placed in hallways and other, quote, unconventional spaces. 8 years later, well, not much has changed. According to the latest available data from the early 2024, rather, an average of nearly 1,400 patients a day were treated in unconventional spaces across the province. But there is one thing that has changed. As of now, the government is no longer releasing statistics about hallway healthcare to the public. Here to explain that change is Snea Dougal, the deputy editor at the Trillium, our Queen's Park Bureau. Welcome back to the program, Snea. Always good to see you.
Thanks for having me.
All right, Snea. Hallway healthcare has been a lingering problem in this province for a lot of years. Can you give us a bit of a history lesson? When did it start to get so bad, and what have the various governments done to try to remedy it?
Yeah, I mean, this is a issue that has predated the Ford government as well. it's been an ongoing issue that's been talked about, every year, at least recently, we've had stats coming out, just kind of placing a bit of giving us a bit of a lens into what the issue has looked like. We've heard from a lot of medical professionals, doctors, nurses, just about the issue. Over the years, governments have tried in different ways. They've talked about putting investment, into hospitals, but also other areas that have an impact on hospitals and the capacity that hospitals have. So that includes things like long-term care. Trying to get more beds available in long-term care, so patients that are in hospitals who would be better suited to being in a long-term care setting can actually be moved out of hospitals to those locations. Other things that have been talked about are more investments in home care. Mm-hmm. So again, there are times when patients may be in hospitals, and able to go home if they were to have some sort of additional support, but it's a matter of having those supports put in place so that they can do that. And then there's just, we've heard from the hospital sector just about the crunch that what they've been dealing with when it comes to funding and the deficits that they're facing. So all of these things sort of have an impact on what you end up seeing, and the capacity within hospitals. Mm-hmm. It's an issue that nobody's. It's still around. It seems to have gotten worse over the years, and nobody's really been able to kind of fix it yet.
Mm-hmm. And the reason we know about it, there's a couple of reasons. I know your team at the Trillium has done FOI requests in the past to getting the up-to-date data on how many Ontario patients are at that moment in unconventional spaces. We're talking hallways, closets, all kinds of different spaces. And then there's also an annual report that comes out that you've reported on every year that has that metric in the report. Is that accurate, Sneh?
Yeah, exactly. So the kind of small glimpse that we've gotten of this has been through the annual report that Ontario Health puts out, has been putting out for the past few years. Ontario Health is kind of the main health agency that oversees the province's healthcare system. So what they've reported over the past few years, like just as Scott mentioned, in early 2024, there were close to 1,400 patients that were being seen in these so-called unconventional spaces on a daily basis. That's an average. The previous year, in 2023, it was a little bit lower. It was a little bit lower than that, but I mean, not significantly. So those were kind of the small glimpses that we got of this issue. Some of our colleagues, Aidan Shamandi, who's now with Toronto Today, he had done a more extensive, he put in a huge FOI request, just getting data back to 2017, which is when the data, like the province's data, apparently, like they started collecting that, or we were able to access it from then. Just taking a look at, what has this looked like over the years and at different hospitals. And it did show, like the data that he got showed that in January 2024, there were close to 2,000 patients that were being seen in these unconventional spaces daily on an average. And that was the highest number up until that point from when the data had been, when they had started collecting the data back in 2017. So it kind of just gives you an idea of like what sort of numbers we're looking at. The numbers for 2025, at least, again, that small, that one number wasn't included in the latest Ontario Health report, which is kind of what triggered this story, because we have been reporting on those numbers for quite a few years now.
Stay. So what's changing now, and why is it changing?
In terms of the data that's being reported. So basically, like going through this report, I realized, okay, there was a whole bunch of kind of stats that we had previously seen in the report and reported on that were no longer in there, one being this measure on hallway healthcare. There were, some others as well related to surgeries, cancer surgeries, and that sort of thing. What Ontario Health wrote in their report was that they have these kind of performance indicators that they look at to kind of track how this health system is performing, and that they were, updating these indicators to kind of go beyond ones that were focused on like COVID-19 recovery, for example, and that there were a bunch of measures that were going to be updated under a new agreement with the Ministry of Health. They then, there was a footnote in that report that essentially listed a whole bunch of the measures that the agency essentially said were going to be retired once this new agreement was in place. This hallway healthcare number was one of them. A whole bunch of the other stats that had been included in previous Ontario Health annual reports were listed there as well. Some of them, the question then became, were they going to just not report these figures in their annual reports any longer, or were they going to stop tracking them altogether? And that's kind of what we set out to find out.
Snay, what's the reaction been? I know one doctor referred to it, and I want to get this right, as utter malpractice to not include the data in the latest Ontario Health report. What are others saying?
Yeah. So, the few doctors, I spoke to a few emergency physicians in Toronto, one in Perth, and essentially on this specific hallway healthcare number. So the government has said that Ontario Health will still be tracking it. It's just not going to be included in this in their annual reports. They're not going to report the figure, publicly in that report. So these doctors that I spoke to, the reaction was essentially questioning, why is the government not proactively reporting these numbers? Like, what are they hiding? There was also the perspective of, it doesn't matter whether or not they're reporting it publicly. Like, we're seeing this every day. We're seeing it on the front lines that hallway healthcare is an issue, and everybody knows it. Doctors know it, patients know it, nurses know it. There was also the one doctor who I spoke to in Perth. He kind of gave, he said, like, from his own experience last year, he had to treat a patient in a toilet, like a bathroom, because there was nowhere else to treat them. He mentioned that they have like an ambulance bay at their hospital, which has a huge window. And often, like, physicians are routinely treating and talking to patients there. So he was essentially saying that, there's no longer any element of like privacy or confidentiality or dignity. He's like, if we were to speak about a patient's personal information in an elevator, for example, like our college would would be after us for disclosing personal, patient information. Yet here we are treating patients in these non-private areas where everybody can hear what we're discussing and what is happening. So it's been a lot of that. I think they also voiced frustration just in that they're still seeing these sort of conditions in their hospitals so regularly. And they said without these numbers being public, there's sort of this lack of accountability. It doesn't give Ontarians the ability to then push and call for better and for the system to be improved.
Well, that's the heart of the story. It doesn't make any sense to me, and that's my question: is what's the why here, Sneh? Why if you know there's a problem, the best way to address a problem is to admit there's a problem, see the problem, and let everyone else see the problem, and then you figure out solutions. What's the government telling you on why they're suddenly not going to publicize this number anymore?
Some of the numbers that they said that they were going to stop tracking, they kind of said were related to like COVID pandemic era recovery and performance during that time. For the ones that they're still apparently tracking, but not publicizing. So what the government said was that, what we got from them was that, like Ontario Health tracks all these sort of key performance indicators. And it includes like ones that they're highlighting in the annual report, but a whole bunch of other ones. So they said that the ones that are, being included in the annual report are the ones that are directly relevant to assessing the agency's performance. And so they have and they've listed about 21 new indicators in this most recent annual report. And those are things like, colorectal, just to give you a few examples, like colorectal, cervical, and breast screening participation rates versus before it was, the rates of these tests being done compared to like pre-pandemic volumes. They're also now reporting on things like the related to ERs, and a couple of these measures doctors did say were important metrics to include. But one was the emergency department length of stay. So like how long are patients spending in ERs? Another was the wait time before a patient gets an initial assessment by a physician when they're in the ER. So they've kind of like put it as these ones are relevant to assessing, Ontario Health's performance. And that's kind of the extent of what we've got from them. Other people, like doctors, the opposition, have their own views, especially given that this was an initial promise by the PCs to get rid of hallway healthcare. And just the fact that that hasn't happened yet. They question the government's motives on this.
Sure, and I'm not going to ask you to say this because you're doing the reporting, you're doing a great job. But I think a lot of people will see this and just think, well, it's just being brushed aside because it's better to not see it because we haven't been able to fix this in a couple decades. So what's the opposition saying to this, Sneh?
Yeah, and I mean exactly that. I spoke to the Liberal health critic, who is also an emergency physician, and he basically said, the data should be public, and he was the one who kind of talked about the data being something that can empower Ontarians to ask for better. The NDP health critic talked about, the government, exactly what you said, the government's promise, and just the fact that this hasn't been fixed yet. Specifically, I'll read you the quote here. She said, "They've decided hiding this data is easier than fixing the problem." So that's kind of been their perspective on this.
Sneh, with hospitals warning about deficits ahead of the next budget, does this problem look fixable, or are we bracing for more of the same, or God forbid, even worse?
Yeah, I think the worry and the concern out there is that it's not going to get better until these other issues are sort of dealt with. One being just funding for hospitals overall, and that was part of the message from a press conference this morning that the NDP held with, and there were some medical professionals there as well, that, they talked about improving like the core funding for hospitals, and in turn that could potentially help this problem of hallway healthcare, looking at, like long-term care, those sorts of things. So I think the concern is that people are voicing is that without kind of fixing the system, this issue isn't going to get better. And I mean, like, from the government's position has been that they're they're pouring money into the health system. And improvements have been made. So they've talked about like funding for tackling emergency department wait times, for like upskilling nurses to work in ERs and things like that. So I think we'll kind of have to see. It might have to be through some FOI.
Well, that leads into my next. That's a great segue to my next question, because so if I understand that right, the government's insisting we're still tracking this information. We still know what's going on, but we're not going to tell the public about it. Right. So how does the Trillium get their hands on it? Just get a lot more FOIs in the future for you guys, Sneh?
Yes, I think so.
Yeah, I mean, it's crazy. It doesn't make any sense to me. If you have that data at your fingertips, you've shared it with the public for a long time, why not continue to share? I feel like it's like this show, Stay. Our bosses always ask, well, are people actually watching the show? What's your data? And we don't give it to them because we don't want them to know that nobody's watching. It's kind of the same. It's the same thing.
It is the same thing.
It's exactly the same.
There's Sneh Dougal, Deputy Editor at the Trillium. Thank you, Sneh, for this. Good to see you as always.
Thanks. You too, Scott. And Frisco.
I was just kidding. People are watching our show. I'm just not
droves. Yeah, of people.
I'm just not going to tell you the exact number. It's we're retiring that metric.
That's right. And it is droves because we drove them away.
You know what? Next time we get asked that question by the bean counters on here, we should just say, you know what? We realize that's not an important metric. We've retired it.
Yes.
And there's other things to focus on, such as how many times we enter and exit the room. Yeah. How many sound checks we do.
I'm going to be Santa right behind you when you tell Jeff that. Right behind you.
Right on. Good stuff.
the word transparency comes to mind.
Yes,
Is it not
it
really
does,
when you?
It does. Look, the reality is the average person like me and you, we're looking for the bottom line, right? If you're talking about an issue, how are things going? Well, show me the data on it. Show me the stats, right? Show me the facts.
Yes.
And it's just, facts just seem to be more and more missing.
Optional.
Optional, exactly, right?
Here's the thing that sticks out to me. I mean, yes, the number of colorectal exams are important. Breast screenings, tremendously important. But Doug Ford did not campaign on breast screenings and colorectal exams. He campaigned on getting rid of hallway healthcare.
Yeah.
So, giving me this kind of stuff, you're really selling the steak, not the sizzle. You know what I mean?
I hear you. And I don't work in healthcare, but I've been open about the fact that I spent a good chunk of time in healthcare getting cancer treatment. And I spent weeks and weeks at UHN getting wheeled under their various tunnels to different treatments and different things. And these people are phenomenal. And they work in the craziest situations, right? And she describes, doctors talk to people out by windows about their – it was happening all the time. Like you just see like they are working – it's almost like I feel like it's a war hospital, right? It's just that you're overwhelmed and you're just doing the best you can. I have nothing but respect for people that work in the healthcare system, not just the people I met there, but the people we've had on the show to talk about it. And I do think – I don't want to speak for them, but I agree with what the ones are saying. It's a slap in the face to them. The public can't know this because I see it every day with my eyes when I come to work, but the public can't know that number. So that just doesn't work. Not in the system. It's the public healthcare system, Scott. We should know the public data.
You're damn right we should. That does not pass the smell test. But hey, it's only been 8 years. I'm sure he'll get it right.
That's right.
One of these years.
Yeah. All
right. Closer look at villagemedia.ca. What do you think about hallway healthcare? We'd love to hear from you. Closer look at villagemedia.ca. For Michael Friscoletti, our editor-in-chief, Derek Turner, executive producer of the program, I'm Scott Sexsmith. We appreciate your time tonight. Let's do it again tomorrow, Friday. Closer look right here across the Village Media Network.
Frisco and Scott's Wardrobe provided in part by Moores, Sault Ste. Marie.